The overall goal of this procedure is to provide detailed instructions on how to assemble and administer a portable obstacle course to evaluate navigation ability in patients with vision impairment. This is accomplished by first identifying a suitable space to construct the course and obtaining all of the necessary equipment. The second step is to create the course infrastructure. This includes painting the adjacent walls and laying down the floor tiles, as well as painting the obstacles and setting up lights. Next, the testing area is prepared for use. The lighting should be set to the desired illumination and the styrofoam obstacles placed. After the course is run, the results can be analyzed by examining the outcomes of percent preferred walking speed, the number of collisions and errors, as well as the two visual identification tasks. Ultimately, the portable obstacle course for low vision applications can be used to assess navigation and mobility capabilities in persons with low vision or who are using artificial vision devices.
One of the main advantages of our course is that there are so many versions that it's very difficult for subjects to memorize it. In addition, because it's portable, it's easily reproduced if you have a multi-center study.
This method helps us answer questions in low vision and artificial vision device fields, such as can subjects avoid obstacles using the device?
Though this method can provide the information about the improvements of an artificial vision device, it can also help to evaluate subjects who have suffered macular degeneration or stroke. It can also show practitioners and subjects their limitations.